understand you have seen many Vietnamese for their spine conditions.
Yes.
With your experience, would you please share with us which conditions are the most common among your Vietnamese patients?
Okay, for the last 10 years, I've been treating patients with spinal conditions from Vietnam. And one of the most common actually is lower back pain. Sometimes I see a few cases of neck pain, but most commonly is chronic low back pain. Occasionally, I see very complicated cases where the surgery has been done here in Vietnam and then either results are no good or got complications. And also I've been doing scoliosis cases for the Vietnamese patient recently.
Would you please advise if these common conditions have any relations to specific groups like ages or professions?
Okay, for chronic neck or back pain, most of the time they are in the 30s, late 30s to the late 50s. Yeah, these are the most common age group. And also among patients who work in jobs that are sedentary, that means they sit in the office all day long. So especially those dealing with accountancy, they just need to sit in the office for a long time, and those IT people. And as for the sports, I don't see that many people with athletes that has got the back problems. But among the sports that commonly cause a back pain are like weightlifting, for example, golf and tennis, this kind of condition. Yep.
How does spine degeneration impact on patients' health?
Now, when you have a spinal disc degeneration, right, over a period of time, you will have more and more back pain. Sometimes they develop disc protrusion, spinal stenosis, and because of their conditions, they are not able to do active exercises. Yeah? As a result, they tend to gain weight. And when they gain weight, the back pain also becomes worse. And in addition, because of the weight gain, it's no good for patients with heart disease, diabetes, and high cholesterol.
Please let us know which advanced methods for spine surgery being applied at Raffles Hospital in Singapore.
So, over the recent years, there are more and more newer minimal invasive techniques. Yeah? For example, you have a percutaneous discectomy for both the cervical and the lumbar spine. And these kind of conditions, this kind of surgical technique, the patients can be either treated as outpatient, that means day surgery, or 1 day overnight stay. Apart from that, we also do like cervical and the lumbar disc replacement. These are the more newer implants that are working much better than the older implants. And these patients have got much better recovery to full function. Over the last 10 years, I've been doing hybrid spinal fusion, which help to protect the adjacent level and prevent them from having to need another surgery in 5 or 10 years' time. So these are all very successful surgery.
Benefits or please advise if these new techniques have any benefit or side effects?
So these new techniques, the very fact that they are minimal invasive, patient has got less pain post-op, less soft tissue injury. That means the scar is much smaller. So as a result, they recover much faster. And also because of less chances of injury, they are all very safe. So the patient downtime is also much shorter for this minimal invasive surgery.
To optimize the consultation outcome, how do Vietnamese patients prepare before coming to Singapore?
Of course, first of all, they must give a detailed history about their signs and symptoms. For example, how long having the back pain, or do they have pain going down the arms or the legs? And then you also must do X-rays and MRI scan. That will help us tremendously in order to make a proper diagnosis for the patient.
Do you have any advice on prevention and early management of spine deterioration?
So one of the most common advice that I give to my patient is proper posture, whether a standing posture or sitting posture. Standing posture, you must stand upright and not stoop down like that. Sitting posture also must sit in a more upright position. And also they must not sit for prolonged period of time, like for example 2 or 3 hours at one stretch. They must get up, move around, and they must also do regular exercises like back strengthening exercises in order to prevent themselves from getting injury for their back.
We thank you for coming to this interview and look forward to meeting you again soon.
Thank you very much.